everybody. Welcome to a new episode of the Oncology Data Advisor podcast on our anatomy theme. Today I'm joined by one of our esteemed guests, Dr. Salma Khan. He's a board-certified anatomic pathologist, both trained in the U.S. and Canada. He completed his medical school in Xavier University School of Medicine and then completed his anatomic pathology residency in the University of Ottawa in Canada. He then completed a GU fellowship at Stanford University and is currently a staff pathologist at Natera. And he has extensive experience in digital pathology and AI and has a passion for digitizing laboratory workflows. Thanks so much for joining us today, Dr. Khan.
Yeah, I'm glad to be here, Wakas. Thanks for having me.
Yeah, for sure. So just to kind of get started, just kind of walk us through, how the digital pathology workflow differs from traditional microscopy-based approaches and the kind of advantages for pathologists and patients.
Yeah, that's a great first question. I think digital pathology workflows, they differ from traditional workflows primarily in how we capture, analyze, and share pathologic images. And I think it's important to, before we start talking about digital pathology, it's important to also discuss what does a traditional workflow entail in pathology. So everything starts from when we receive the tissue from the surgeon. It could be a smaller piece of tissue, like a biopsy, or it can be a larger surgical resection part of an organ. And then the tissue is then prepared in the lab. It's sectioned, and then it is put on a glass slide and stained with what we call a hematoxylin and eosin stain, or an H&E stain. And then that goes to the pathologist, and the pathologist then uses a traditional light microscope to examine the cellular structures and to kind of ultimately give a diagnosis. And one of the things we do in pathology, it's a very collaborative specialty, and we often get second opinions. So, in order to do that, because we have a physical glass slide, we often have to physically take it to our pathologic colleagues who then can have a second look at it. Or if you have to send it out, then you have to send it uh, through a shipment to an institution so they can have a look at the glass slide. So there is some transference of patient information with regards to the glass slides. And then lastly, one of the things is, we have these glass slides. We often have to then store these, and those are often done on an on-site secure storage, or it is stored at an off-site secure location. So, one of the things that digital pathology does is everything's the same up until the point where we have to analyze it. So when the glass slides are created, those are then digitized and scanned by high output digital scanners, and then they are then, which then create high resolution images and then are given to the pathologists to go ahead and analyze them. And they often do it on their computer monitor through an information management system or an IMS, depending on what company you go with. And I think that offers a lot of advantages because then you have these high quality images right available to you on your computer screen. And then, if you want to order things, you can go ahead and order it right away. You don't have to wait for the glass slides to come to your office. And then also you can share very easily these cases with your pathology colleagues, both locally and then also internationally as well, which really does enhance patient care. And then when it comes to storage, this really helps because often there's a finite amount of storage space on site and off site in the storage location. So often they are then stored on a digital cloud, which really does free up space. And we all know that in hospitals, their real estate is very, very precious. And so opening up kind of areas that would otherwise be for glass storage can be very, very helpful. And I think what this does is, it does increase workflow efficiency. And because you're getting really, really high quality images, it can really enhance the amount of detail that you can see and then enhance the, diagnostic accuracy of pathologists and then ultimately for patients. And, that can really, really help because, as we'll discuss, we're in an era of precision medicine and personalized therapy, and getting the most accurate diagnosis is something that we're always striving for.
Yeah, thanks for sharing that. I think you raised some really good insights, especially about the shared process for digital and traditional workflows up to a certain point. I remember as a resident, kind of every day you send a sample, especially like for new malignancy, and every day you're checking like the pathology is still in process, and then you're wondering like, is it that there's just like a big backlog? But then I did molecular medicine rotation earlier this year, and actually hung out with some of the pathology fellows, and as you mentioned, it's such a collaborative and iterative process, just preparing a single slide or specimen that it definitely takes a lot of those steps that you mentioned. It's also interesting because during med school, I went to med school in the 19th century, and at that time, everyone was using microscopes. But I think by the time I finished, a lot of the early stage medical students in anatomy were using computers and software for learning pathology, learning anatomy, and things like that. But it seems like in healthcare and hospitals in general, there's a lot of resistance to change. So, what kind of strategies do you find to be effective for helping the hospitals or pathology departments to implement these digital workflows that you talked about?
Right. Yeah. No, that's a great insight, Wakas. I think that's a really good transition to kind of talking about, what are the challenges with digitizing workflows. And, you had mentioned that when you had started doing kind of your later rotations, you did start to see a lot of this digitization in the pathology process. But we're not all there, right? We all are at different, I always say we're always at different digital journeys,
Yeah.
whether you're at an academic institution, whether you're training. So that's something that I've really found, and I think first and foremost, one of the most important strategies is to have a really good, strong leadership and
Mhm.
vision. And I think along the way, you need to have some really good um, kind of digital pathology champions along the way, which can then act as experts and be the point person if they have any questions. And that's kind of how I really got into digital pathology is I had really had a passion. And, I ended up being a champion during my training, during fellowship and at Natera. And I think that's really important because often a lot of people have a lot of questions and don't really know too much of how to implement these digital workflows from their traditional workflows, as we had discussed earlier. And I think, we talked about how collaborative the process is. And I think with anything, and, this also reigns true in pathology, is you need to have stakeholder buy-in. So there's a lot of players in the game, as I say, that not only are there pathologists, but there's pathology assistants, there's laboratory technologists, there's also the IT support that's really important. And then, at the end of the day, you also have your clinical colleagues and patients. So I think it's really important to have buy-in and have that multidisciplinary approach. And, just imagine, you have a huge academic institution and you're trying to implement a huge digital workflow. There's going to be a lot of resistance at first. And what I find that is really helpful and some advice I give institutions who are trying to get digital is, you know, during your comprehensive planning process, it's important to in, include pilot programs. And that's really good because then you can introduce certain small segments of digitization and not do it all at once, which can be very difficult for people to integrate. So if you do it, and I find that some places they do certain parts of their workflow, so you might even do it subspecialty. So you could say, okay, you know what? I want to do our thoracic pathology workflow. I want to digitize that. And if that goes well, we'll kind of go into maybe your genitourinary pathology workflows. And I've seen that done. And that's really helpful too, because you don't go all in. And I think people are um, more apt to be more open to integration when you do it that way. And then also too, throughout the process, you're going to need training and education, and you're going to also need feedback throughout the process. And I think that's really important. That's one of the things I have a passion for is, I love being that point person to help educate people and answer their questions. And throughout the process too, having kind of weekly feedback sessions are really important to really understand what's going well, what isn't, and how everyone can kind of help each other in order to be successful. And I think that that's really helpful. And, I love doing it. And it's like one of my big passions. And I really do see in the future a lot more institutions becoming digitized, really to enhance patient care.
No, thanks for sharing all that. So how do you kind of get started in your own digital journey and kind of being AI champion yourself?
Right. Yeah, no. I think like I was saying too, is I've always been kind of at the forefront of technology. I really wanted to understand where the future of cancer diagnostics is going and pathology. And I love to kind of integrate, like I said, digital workflows, but also I have a passion for artificial intelligence and machine learning. And I think that's kind of one of those things where it's really important to understand everybody when I go to all these conferences, these oncologic and even pathology conferences, a lot of them, all the vendors, they're giving people exposure to artificial intelligence and telling them about their new platforms. But what happens is a lot of the time, people, in order to have a really good, robust artificial intelligence software, you need to have a really good digital pathology workflow. And I think that that's really important is I got a passion of digital pathology and I really understood that the only way you can get really good artificial intelligence software to help you through the pathology process is to have a really good, robust digital platform. And I think that that's what I really got passionate towards digital pathology. And I think the ability to work remotely as well. A lot of the time, that's the beauty of when you digitize something, you can work remotely, but also you can then share your questions and your cases with people all over the world. And that's something really, really exciting because it avoids a lot of the time shipping of those slides that I had said. And you can get answers really quickly. You could even go live with your fellow pathology colleagues, say on the other side of the world, and you can actually go through a case together, annotating cases, showing them. And that's really, really exciting. Something that you were not able to do before in those traditional workflows. And I think that that's kind of really, really exciting and something that I love doing because you get to harness a lot of the amazing
Right.
expertise around the world.
Right. Yeah, and I'm really excited to hear about your journey and some of the things that drive you. Maybe just to focus on one specific technology or area. At Natera, I know there's a lot of focus on MRD detection, minerals, residual disease for those who aren't familiar with the abbreviation. Obviously, it's becoming really big in medical oncology as we kind of, help use that to guide decisions, especially for a lot of our liquid cancers. But talk a little bit about how the technology works and how it kind of complements what, how traditional pathology methods work for cancer monitoring.
Right, yeah. So, we've kind of entered an era of, we had mentioned, and you having an oncology background, Waqas, you really can kind of attest to this, but we've really entered a an era of personalized medicine and personalized therapeutic regimens for patients. And I
Mm-hmm.
think that when it comes to minimal residual disease or MRD testing, I really often, when people ask me, tell me a little bit about it, what I tell them is, you know what? It actually gives another tool in the patient care toolkit for providers. And what I mean by that is, now we're able to detect if a cancer is still present in the body, or we call it the minimal residual disease. And I think that's really important because then we're able to we're able to proactively treat that patient and detect it way earlier than maybe imaging can say that their cancer is back or even clinical symptoms. And how minimal residual disease, the kind of the underlying process for that testing is something called cell-free DNA. And so cell-free DNA, there's two things I'll kind of talk about here. So there's cell-free DNA, and then there's something called circulating tumor DNA or ctDNA. So often, we all have cell-free DNA as a cell is undergoing changes or apoptosis, cell death. It releases these small fragments of DNA into the blood, which we're able to detect. And we can detect it through something called a liquid biopsy. And it can be a very sensitive way of detecting a cell's DNA. Uh, Similarly, when you have cancer, cancer cells do the same thing too. When they are dying, when they die, they have a very, very short half-life. And what they do is they actually put out their own tumor DNA into the blood which can then be detected through something that we call a liquid biopsy. And that's really, really important because, you had talked about how it complements kind of the current process. So I think what, we were talking about before, currently, in order to have a tissue diagnosis, a patient has to undergo some sort of an invasive procedure, either it's a biopsy or they have a bigger surgery or called a surgical resection. And what MRD testing and cell-free DNA testing does now is through a liquid biopsy, it offers a more kind of non-invasive, real-time tool that can provide additional insights into kind of the patient's cancer. And I think that, right now, currently, the way we do it, or has been done traditionally, is you have follow-up tissue biopsies if you are worried that the patient is exhibiting some symptoms, that there could be a recurrence. So the patient does have to go in, you have to have some OR time, you have to have some time to go ahead and get that biopsy. And so, that's kind of what we do now. But, what we do now is through a liquid biopsy, we're able to track the patient at different dynamic time points in their cancer journey. So if a patient has, like we have a follow-up blood test for, to check our kidneys or to check our sugars in our blood, you can do that with MRD testing, and you can check the patient every 3 months, every 6 months, or a year, depending on what your follow-up is, and you're able to track them dynamically over time. And one of the things that that does is, it's like I was saying before, that currently the way you actually track a patient is not only through tissue biopsy, but you do it through imaging and you do it through their symptoms. One of the things that MRD testing allows is you're able to detect it way earlier than a mass may show up in a radiologic image, or even the patient has clinical symptoms. So it's a very powerful way to really track a patient's cancer, but also to detect it early, where then you're able to implement a therapeutic intervention way earlier than we were able to do before.
So thanks for sharing everything about that. It's obviously very exciting technology, and I think it's going to continue to evolve how oncologists think about treatment decisions and diagnostics and kind of everything else that you mentioned. So I know you have sort of large background in consulting with different companies and working with pharma companies and different healthcare institutions. What can we expect, from pathology in the next few years, especially as it relates to oncology?
Right. As I had mentioned, Wakas, it's a great question. Everybody says, like, now what? What's the future? And I think that, we are in the era of personalized medicine. And what I see now is, more so than ever, not only is digital pathology being implemented, but a lot of these artificial intelligence software is being implemented. And I think that that really helps because it's going to help complement current pathology workflows, but also it'll allow us to, uh, integrate a lot of these AI diagnostic software and platforms to enhance patient care. So, for example, one of the things that is the cornerstone of personalized medicine is biomarker discovery. And a lot of the time, what happens is, in order for us to order a biomarker test, it's easy to order it, but then it needs to be also analyzed, and that's done by a pathologist. And a lot of the time, it's very manual, and there's a lot of, say, counting that's involved in order to make an assessment in a report. So, for example, when it comes to a lot of tumors, and the big one that this biomarker was, had a really big diagnostic impact was HER2 testing. And so HER2 testing, what we do from a pathology perspective is we have to essentially count the number of cell nuclei and talk about the staining from an immunohistochemistry standpoint, and even fluorescent in situ hybridization, and give a report. And a lot of that's very manual. There's a lot of interpathology variability, but we have artificial intelligence software now that can help to actually count ahead of time, triage these cases, and then have a report ready for a pathologist who can then verify it and then sign it out. So it's a lot of the time it does help. It helps to maximize and create efficiency workflows. Um, and that's kind of one kind of thing that I do see. And then also another exciting area is, there's a lot of now trials going on for a cancer vaccine. And so that's really an exciting field. And there are current trials undergoing now by major pharmaceutical companies that are actually in randomized phase 3 clinical trials looking at the efficacy of a potential cancer vaccine. So those are the two areas that I really do see that it's really exciting, not only for the future of pathology, but cancer diagnosis and as a whole.
Yeah, no, definitely agree with all your insights, and thanks for sharing everything today, especially about implementing digital pathology in the workflow, and about the importance of pathology champions, and about pilot projects. I think those are some really really good insights for how to kind of advance the implementation of some of the advancements we're seeing in sort of hospitals and institutions today. So thanks so much for your time again, Dr. Khan, and we really appreciate your time.
Thanks so much, Wakas.